Hi, my name is Greg Fell. I'm Director of Public Health in Sheffield. Short video on self-isolation. Arguably the single most important thing any of us can do to reduce the chance of spread of the illness from you to others, me to others. It's a really critical part of the strategy. This video is about what you can and can't do and why. Self-isolation means that you should stay at home. Don't go to work, school or other public areas. Don't use public transport or taxis. Don't leave the home to buy food or essentials or to exercise, and don't have visitors to home. It's different from social isolation or lockdown, where people are permitted to shop for essentials and to have one period of exercise out of the home. The self-isolation is different, and it does mean stay at home. It does mean don't go to work, school, etc. And it definitely is the single most important thing you can do to help stop the spread, other than getting a test if you are symptomatic. So thank you to those who are self-isolating, because you are definitely helping protect loved ones and our communities. So when to self-isolate? The government website is pretty helpful on this. So when to self-isolate? If you have symptoms of COVID-19, however mild, self-isolate for 10 days from when those symptoms started and arrange to get a test. Even if your symptoms are really mild, and the purpose of the test is to rule in or rule out COVID-19. If you're not experiencing symptoms but have tested positive for COVID-19 after having had a test, then you must self-isolate for 10 days, starting from the date the test was taken, the swab was taken. If you develop symptoms during the isolation period, then I'm afraid you've got to restart that 10-day isolation period from the day the symptoms started. You'll have noticed that the government have introduced a regime of fines, so you could be fined if you don't stay at home and self-isolate following a positive test result or being contacted by NHS Test and Trace. After 10 days, if you still have a temperature, you should continue to self-isolate but seek medical advice. But if you don't need to self-isolate after 10 days, if you only have a cough or a loss of sense of smell or taste, as those symptoms can go on for several weeks after the infection is gone and you're not infectious anymore. If you live with others, the other household members must stay at home and not leave the house for 14 days. They are close contacts of a case, and the 14-day period starts from the day in which the first person in the household became ill, or if they don't have symptoms, the day the test was taken. If you have symptoms, try and stay as far away from other members of your house as possible. We all accept that's easier said than done. It's especially important to stay away from anyone who is clinically vulnerable or extremely clinically vulnerable, i.e. shielding, if you share a household. And the extremely clinical vulnerable guidance on the gov.uk website has some really helpful hints and tips on that. So you can reduce the spread of infection by washing your hands regularly for 20 seconds using hot soap and water or hand sanitizer, and covering your mouth when you cough or have a sneeze. Staying at home for long periods is hard, it's frustrating, can be lonely, and you may feel low, so particularly if you don't have much space or access to a garden. The British Psychological Society produced some really helpful advice a couple of weeks ago. It's worth a read, but the key points are these. Planning ahead. It may come to us all at a time when we don't expect it, so plan ahead, have a plan, think through what you're going to need in order to last and stay at home for the full duration of isolation. Talk to your employer, family, friends. How can they help you? How will you get access? Think through how you'll get access to food and other supplies like medicines that you might need during the period. Friends or family might be able to drop something off or ordering supplies online, but anything that's left, make sure it's left outside your home for you to collect. Don't invite anybody into your home. Ensuring those that you keep in touch with friends and family via the phone or via social media. think about things that you might be able to do with your time. It's a long time to be at home, and there may be things that you want to do. So plan out full days of isolation. Many people have found that helpful, just using a calendar. What are the things that I can do that I've always wanted to do? Now you've got 10 days where you've got pretty much you can't do anything else. Exercise remains good for you. That may be easy for some, more difficult for others, but if you can take light exercise and you're able to, then please do so, because it remains good for us. Lastly, whilst it is a pain, no doubts about that, whilst there are things that we can do to plan to ease that time, it is the most important thing that we can all do to protect our loved ones from an illness that is not a trivial illness for some. So even if your symptoms are mild, it really is important, because it is the thing that we can do to reduce the spread of the virus.